All right. Glad to have you here tonight. We'll talk, try and make this a little interesting. Talking about infectious diseases that affect you. We're not going to go over everything that really can affect patients. Really, it's more designed to catch the big players that can affect you, especially that can affect, get you guys infected. So we want to avoid that, and so I'm going to talk about some of these diseases. So there's different types of ways that you can get infections. And up here, I've got a couple of things highlighted. There's bacteria, there are mosquitoes. Anyone know what this is in the top right corner? This gray thing up here? You know what that is? It is. Good call. It's a scanning electron micrograph of the head of a tapeworm, so it's pretty long. And down beneath it, these are viruses that are starting to enter cells, and this is the outside of the bacteria. And these are some other organisms that we'll talk about. So there's a lot of different ways that we can get infectious diseases. And some of them, it doesn't take a whole lot to get infected or get exposed, like this little kid's doing. Although some people would probably argue there's no harm in that, not going to get infected. So today we're going to talk about public health and the importance of public health versus personal privacy and the purposes of trying to maintain public safety. We'll differentiate and talk about the different types of things that can cause infections, and we'll describe how those get into us and the process and what the body's defense are. And then I'll focus on the diseases that are important to you and the things that we want to avoid, as well as what to do if you're exposed. So the United States has instituted a policy of public health, and in general in most counties there's a Department of Public Health, and they kind of regulate certain policies and procedures that we follow that affect us as EMS agencies, as well as the public in general. And sometimes the good of the public will overpower the privacy of the patient. We'll talk about that so that the public good can be preserved. But there are national things, and one organization that nationally plays a big role actually on the world stage is the CDC. That's an example of the public health agency. And then the WHO organization also nationally. So there are some disease states, some infections that are required by law to be reported to these agencies so they can track them, so we can see, holy smokes, there's an epidemic of this going on. How can we prevent people from getting infected? And there are some diseases that we don't really report. And some of these, for example, are things like appendicitis or pneumonia, urinary tract infections. We want to know about the general health of these, and there are other things in medicine that will track it. But for disease reporting, there are some guidelines for unique pathogens that have very high mortality rates where you can die from or can spread very, very fast, and so we're required by law. In fact, HIPAA, that normally protects the patient from disclosure, will require healthcare professionals to disclose certain disease states in a confidential way to the Department of Health. And we'll talk about those. So some of the diseases that we haven't seen for a while, with a few exceptions. The top left is anthrax. Hopefully we don't have to worry about that. And down here in the bottom left, anyone know what this is? This is the inside of a guy's thigh on the groin. You get these bumps, and this is an example of it back in the 15 and 1600s, a drawing. Anyone know what that is? The bubonic plague. That's a bubo, B-U-B-O-E, so a big bump with a bacterial infection. And I put the pictures on the top right because it's an example of pertussis and whooping cough. And that's particularly interesting because a couple of years ago, the state of Washington was the epicenter for whooping cough in the United States. So we had the highest incidence of whooping cough, and we think that that's the case because there are many parents who are electing to not immunize their kids. And as a result, the people that are immunized won't get infected, but because there's more kids that aren't, it starts to spread very quickly. And the state of Washington has struggled with this. So, a couple other diseases that are reportable by law. Okay? Hopefully none of you have experienced that. I haven't. I hear that my patients that I see, they talk about that, and it's very uncomfortable. Okay? Who knows what the hand is showing up in the top right corner? That rash. If you see a rash on the palm of somebody's hand, you probably shouldn't shake it. There are a few things that cause rash on the hands and the soles of the feet, and you don't want any part of those. Okay? That's an example of syphilis. Okay? And of course, this was from a news site that shows a couple of years ago that some of the porn sets down in the Los Angeles area got closed because HIV was taking off, and they told them to stop making movies until they could figure out the source and shut it down, so that Parishton thought we'd destroy the industry. So, for patients to the public. So, these organisms that can infect you are everywhere. They're in the air, they're on your skin, they're on surfaces, they're in your hair, they're on desks, tables, and believe me, they most definitely are in your rigs. Okay? Let alone the bathrooms. You guys keep a clean house, right? Okay? There are some organisms that are good organisms. So some that share a relationship with our body and do a productive thing to help us out. They don't cause disease. They sometimes help in our defense and sometimes help with preventing the growth of bad organisms. So a good example is bacteria in your colon. So you may hear people talking about that they're going to get probiotics because that helps good bacteria in your intestines, so then you're healthy and you don't get a lot of diarrhea. And so sometimes we'll refer to then, as opposed to that, we've got the bad organisms, which you call pathogens. Some of the ones you may have heard of are, one is C. diff, stands for Clostridium difficile. It's a very virulent, a very potent bacteria that causes extremely profound diarrhea that can wipe people out. Another one is H. pylori. The Australian that discovered this bacteria won the Nobel Peace Prize in the late 1980s. It's a recent discovery. He kind of broke the mold. The pH of the stomach is usually around 2. It's very acidic. And he had the theory that there were bacteria that were living in the stomach, and that was causing people to have ulcers. And the scientific community laughed at him for years and years and years, because they're like, no bacteria can survive at a pH of 2. That's ludicrous. And he ended up proving that to be the case and won the Nobel Prize. And now we're actively treating H. pylori in people that have peptic ulcer disease. There are some pretty virulent organisms that can cause some very bad diseases. Necrotizing fasciitis, where it literally eats at your skin and crawls and spreads through your skin up your extremities on an hourly basis. So it can go from your toes to your hips in a couple of hours and just destroy all that tissue. Very scary disease. And then we know about things like HIV. Those are definite pathogens. So as we look at the different type of organisms that can infect you, I'm not going to test you on all these different parts, but the purpose of this is to inform you and let you know as you hear about things in the media or you hear doctors talk about stuff so that you kind of have a basic understanding. One of the most common things that infect us are bacteria, and they're pretty small. They're usually about the size of a red blood cell, an individual red blood cell. So we have to have a microscope to see these. They're one-cell organisms, and they can function on their own. So they can sit out here on a table and survive for a certain period of time. They can try and generate energy from food and debris nearby, but generally they require a host to keep them alive. So once they've been out on the table for a while, a lot of them will die. But they live next to the cells in your body, inside your body, and can cause problems. There's different types of them by the shell that they have. And so you may hear about people talking about something called gram-positive and gram-negative. It has to do with the stain. And this is actually a microscopic slide that shows the gram-positive is the purple that was on the one side, and the gram-negative was the red. And so that's just a way that we classify it, and it helps us understand what antibiotics to use. Another classification that you may see is we describe them as whether they're little balls, or whether they're little rods, or whether they're little corkscrews. And so we call those cocci, or rods, or spirochetes. And again, not that you need to memorize them, but you'll hear medicine talk about them. Gram-positive rods, that tells us something about what antibiotics to use. But most of the time, these bacteria will develop poisons, and it's that poison that leaks out from the bacteria that causes problems in our body. And so what we do is we have antibiotics that come in and try and get through the wall of those bacteria and kill the bacteria. And so it's kind of cool, because if you can find a medicine that can get through the wall of the bacteria and kill it, but it doesn't get through the walls of a human cell, that's the perfect situation, because you don't want to destroy yourself, you just want to kill the bacteria. So that's part of the art of medicine, is trying to find a medicine that will only affect the bacterial cells, but leave your cells alone. Okay? The next type of a pathogen is a viral pathogen. This is important. They're very, very tiny, and they live inside cells. It's hard for them to survive outside of a host. And what they do is they find a host cell, and so the bottom picture is of a cell, okay? And this is a micrograph of the structure of a virus. And it has these little legs, and it comes down and it lands on the cell, and then it has kind of like a little knife that stabs into the cell wall, and it injects its DNA into the host cell. And then its DNA or RNA gets inside the cell, and it uses your own cell's tools to replicate and multiply. And it replicates and builds 1,000 viruses inside the cell, to the point that that cell gets so swollen it breaks and dies. And then now it's made 1,000 copies, and it showers the other cells nearby, and the process just duplicates, duplicates, and duplicates. And that's how you get infected by a virus. So it uses your own cellular mechanisms, your cells, to do its dirty work and to stay alive. Okay? And so that's how HIV works, for example, is that the virus will come in, and instead of attacking a muscle cell or a liver cell, it comes in and it finds your your body's immune cells, the white blood cells. It injects itself in the white blood cells and destroys all your white blood cells. And then when you don't have any defense mechanisms, you die of a cold, because you got no white blood cells left to protect yourself. That's how HIV kills. Viruses are very nasty, okay? And so the hard part is that you can have somewhat relatively benign viruses like a cold. It's a hassle. It's uncomfortable for a week. You're making a lot of snot. You feel achy and stuff like that. And eventually your body will kill all the viruses if you're done with it. But some viruses like hepatitis and HIV, they spread so fast. And then what they do is they hide inside your own cells. And then your body can't find them. Because instead of living outside the cells, it lives inside your own cells. So then your body's looking for them, and it's hiding inside so it doesn't know. And so it's hard to kill. Okay? And that's what happens with different viruses. And so the challenge is there's not a whole lot of treatment, because the viruses live inside your own cells. How do you kill the virus that's hiding inside your cells without killing your own cells? It's really hard. And so that's why if you get exposed to something, one of the few things we can do is try and slow the virus down to prevent it, to see if we can prevent it from getting into your cells. And then maybe we can keep you from getting infected. Because once you get infected, we don't have a lot to help you. So that tells you the moral of the story is don't get infected, because we don't have much to fix it. And a perfect example of this has to do with the cold virus. We don't have anything to treat the cold virus. Once you get it, it's in your cells, and eventually the body will catch up and find that virus and kill it because it's not very virulent. But once you've been exposed to an organism, your body develops a memory against it. And so if it sees it again, it will kill it before it spreads really fast. The problem is, one of the last counts that we had, there were 189 cold viruses. So basically, after you have 189 colds in your lifetime, you probably won't get any more colds. Because you've had them all, your body's seen them all, and the next time it gets into you, it's going to attack it instantly and kill it. You just have to go through the 189 colds to get there. So obviously, things like this can very quickly spread these viruses, and even if you're not attacked by the droplets, wherever that got sprayed, as you go into somebody's house, on their countertop, on their couch, wherever you're touching and sitting, obviously you're liable to be exposed. So we've talked about bacteria and viruses. Those are some of the more common ones, organisms that can be out there, but there are some rare ones. And I bring these up just for completion's sake. One of them is another organism that won the Nobel Prize that they discovered, called prions. Very scary little organisms. And they cause mad cow disease, for which there is no cure. And it turns your brain into Swiss cheese. It punches holes in your brains. And so the human form of that is called Creutzfeldt-Jakob disease. And so, I don't know if you remember, 15 years ago, there was a big problem with that in England, and the United States banned any import of beef from England because they were struggling so bad. It's tough to kill that organism. We haven't seen that here for a while. Another common one is fungi or yeast. If you've been working hard and you take your socks off at the end of the day and your feet look like this, you've got a fungal infection. And it's warm and moist in between your toes, and that's where all the sweat is, and it just grows out all the stuff that's in your shoes, and it causes the skin to get dry and flaky, and so you just need to get antifungal powder. And if you don't, then in 20 years, the gift of that recurrent infection is going to look like this, where your toenails are about as thick as a marshmallow, but they're hard like rocks. In fact, to trim those toenails, they have to use like tree loppers, those big things, to cut them because they're so hard. Here, let me give you a pedicure. So take care of your feet. Okay? Other pathogens are protozoa. These are single-cellular organisms that tend to be found in the environment and will swim. They can be spread by mosquitoes. And here's an example here of a parasite or a protozoa that's spread by the mosquito, causes malaria and gets into your blood. Anyone know what this purple guy is over here on the right?
He looks happy.
He does look happy, but I promise you, if you get him, you will not. You will look like this. And you get it by doing on the left. That's Giardia. And so if you're taking a drink downstream from something where the animals have been, you haven't been paying attention, that protozoa can be your friend for a little while and cause some discomfort. So then another one are these worms that we were talking about earlier, and these are just smaller version of like a worm that you would see in your lawn. But you can see if we look at them up close, they're kind of scary. They've got these suckers on the edge and then these little tentacles that they can pinch through your cells and latch on. In fact, some of these worms and parasites get so long that they can be 10 to 15 to 20 feet long. And so in Africa, what they will do is it comes out the rectum. tail does. And they figured out, and what they'll do is they'll pull on the tail. If you pull on it too hard, it'll break off and crawl back up inside. So what they do is they tie the end of it to a stick. And then once or twice a day, they kind of roll the stick a little bit. And it takes a couple of weeks to just, like toilet paper, just keep rolling, pull this thing out. That's what they do in Africa. Here in the United States, we've got a pill that you can take that will kill it and flush it out. But that's how long. There have been tapeworms that have been longer than this. And so what happens is it's developed through what's called the fecal-oral route. So they have farm animals that they eat, and the meat's infected with these organisms, but they didn't cook the meat hot enough, so these organisms are in the meat and they don't die, and so then you eat it, and it gets into your intestines, and it discovers, hey, it's a nice warm environment. And the little eggs hatch, and they find a happy place, and they stay there until they get 20, 30 feet long, and they take all of your nutrition, and these little kids get really skinny because they're basically fasting, because all the food they eat, the worms eat it. So they don't get any nutrition. And that's how they figure out, oh, I think he's got worms. So they have to go looking for it at night. They come out at night. So they have to look at the kids at night and find the little tail coming out. All right. Had dinner earlier, right? Okay.
Makes me itchy.
So let's talk a little about diseases. We'll talk about the host, which can be you, the infectious agent, where they live and how it gets transmitted from one person to another, because not only will this help you improve the care of your patients, understanding some of these fundamental things, but it'll keep you healthy and keep you safe. Because sometimes we're just talking about a cold, sometimes we're talking about some pretty bad you don't want. And so one of the things that's important to know is a reservoir. And a reservoir is where the pathogen lives while it's waiting to infect the organism. And so sometimes the reservoir can be a stagnant pool of water. Sometimes it can be the meat of a pig. Sometimes it can be other animals or insects. And it's where they hang out. And so if they don't get into another host, then eventually they'll die. And some of these stressors in the environment can affect how long they survive in the reservoir. So things like heat or cold or chemicals. And so that's why when we try and prevent infectious disease, we're trying to go after these reservoirs. And that's why we've got these solutions, bleach solutions, or these other chemicals to decontaminate and clean the equipment to try and attack these organisms where they are. And so then, if you come in contact with a reservoir where there's some organisms, somehow it's got to get from where it's at into you. And so there's different ways. It can happen airborne, and a good example is RSV in little kids or colds. It can happen by transmission by blood, and that one's a common one. You all know about that. So you're wearing, BSI, you're wearing gloves, so we're a little more careful about that. But another place that you can get infected from is a fomite. A fomite is just a medical term for some object that's a temporary holding place, like your stethoscope or the handle on one of your bags. Think about it. You see a patient, you walk in, they got fevers and chills, they're sick, you put your gloves on. So BSI, things are good. And you go and assess the patient, you touch them, you check and see if they've got pulses, all this kind of stuff. And then AMR shows up, they load them up, and then you reach down, you grab your bags, take your bags out to the rig, load them up, take your gloves off, come back here, and the next time you go to check your bags to make sure that they're all stocked, are you wearing gloves? Because you just moved whatever infectious agent is on that patient, you just moved it on the bags. And now you're not touching it with gloves. That's a fomite. Or maybe the patient's getting sick and it got toned out as a Bravo and you want to change it to a Delta. You got your gloves on so you're safe, but you reach down to your radio and you upgrade it to a delta. How's that radio doing? So you should make a choice. You should make a conscious choice as you roll on scenes to think about these things and how organisms are going to move from one place to another. And perhaps there should be one person, maybe the guy that's doing the documentation, that's also going to work the radio and all that kind of stuff so that you're not going to infect your own gear. Okay? So there can be contact. So we talked about airborne, but if they touch you or you touch them and you don't have any barrier, then you can get it, whether it's coughing or sneezing. And then other things like some of these other viruses like chickenpox and meningitis can come from intimate contact. And then there's the oral route. So, you shake hands and then you sit down, you come back to the station, you eat. You're going to put it into your body if you're not careful. And so washing hands are really important. Routes, because they affect how well you stay healthy. And so here's an example of some of the not so fun diseases and how they get transmitted. I just put them up there so that you can see them. Some of the common ones, hepatitis, okay? So hopefully we don't have to worry about you having sexual contact with your patients. But you can see there's the bloodborne ones, there's a lot of airborne ones, and then indirect ones. So things like herpes. That'll happen right here on a table or on your back. So you have to think about these things. And so when you see patients that look sick, think about, okay, how am I going to prevent whatever they got from getting onto me or my crew? Okay? All right. So that's why, as we talk about safety for you and for the patients and for other patients, what can we do to prevent the infection? So the first thing is, well, can we kill it before it jumps onto us, before it gets to us? That's disrupting the reservoir. And that's why we've got these bleach and chemical solutions to try and decontaminate everything. So if it is sitting on your bag, if it is sitting on your table, if it is on your radio, as you wipe it down, hopefully you kill it and then you're not going to get infected by it. Alternatively, to prevent something airborne or blood or something, we've got BSI. So we talk about hand washing, gloves, obviously sharp safety, and then I continue to bring up and remind you the importance of wearing glasses. And all the rigs have safety glasses. And I know it's a hassle, but I can't tell you how important it is. Because if you go on scene and you're getting close to somebody and all of a sudden they have a convulsion and they cough, and you're like, well, I wasn't expecting them to cough on me. Yeah, I mean, who's expecting it? That's not the problem. You got to expect the unexpected. And that's too late. And you've been infected. So I was taking care of a patient who is an immigrant a couple of years ago, and the nurse came and got me in the ER and said, you need to come see this patient. So when that happens, most of the nurses are pretty seasoned, and I'm like, okay, this is a sick patient. I walk in the room, and he's barely breathing. He's kind of like passing out, and I can hear this wet cough, and he's going into respiratory failure. And he doesn't speak English, so I've got this little computer monitor that's got wireless internet that we use to try and get like the translators. So I've got this up next to this guy, and the nurses are hooking him up and putting IVs in. And so I'm yelling at the monitor to try and tell the interpreter to try and convey and get some kind of a history. And finally, this guy just passes out. And so I tip my leg and I kick the monitor across the room. I drop the bed, reach over, grab the intubation box, and intubate the patient. So I'm down like this, got the laryngoscope in, I see the cords, I put the tube in, pull the laryngoscope out, I'm starting to bag it, and I intubate him. And so stabilize his airway. I didn't have time to get an x-ray. This guy just crashed. His blood pressure's okay. I start getting an x-ray, doing blood tests. He's got a huge rip-roaring infection somewhere. His x-ray just looks like he's got infiltrates everywhere in his lungs. So I didn't have time to do anything else. I had gloves, but I didn't have time to do anything else. 3 days later, the patient dies in the ICU. And they've done additional tests, and he's an immigrant. And one of the tests they did was a gold quantiferon test that looks for tuberculosis that happened to be positive. So he died from tuberculosis in his lungs. Now, I wasn't kissing this patient, but I think you could make a pretty good argument that I was pretty freaking close. Because I was down in his face, and I put a tube into his lungs that directs all the air from the lungs back into my face. All it would have taken was for me to back out of the room for 10 seconds, reach over to the supply cabinet, and grab a mask and a face shield, which I do now. Fortunately, for some reason, I'm not positive for TB. My skin tests and my chest x-ray have been negative. But it scared the crap out of me. And I was like, I'm not even sure I want to go home. I got kids. I got to breathe on my kids. So it's scary. And the things that you don't expect to happen, this is what we do. This is emergencies. And so if you go in and these tools are here, and then you think about it after the fact, God, I wish I would have done that. That sucks. So I can't emphasize enough the importance of BSI and scene safety and taking advantage of the tools the district provides. So you don't have to gown up like this guy in this high-level suit and tape everything to decon everything, but you should be like the guy on the right, fanny pack included. Right? That's what's coming next. Christmas presents, everybody. Fanny pack chief. So, but he's got gloves, and notice he's got the eye protection. Okay? Please take advantage of the eye protection. All right. So, in order for you to get infected with something, it has to happen the right way. So, if somebody's got hepatitis and it's transmitted by blood, and your partner's putting an IV in, and some of the blood sprays out and gets on your arm, what's the likelihood you're going to get infected? 0. Because that blood has to get into your body. Now, if you've got open sores or cuts or abrasions on your skin, well, then you should be nervous. Okay? So, the transfection, the transmission of the infection from one person to another has to happen the correct way. Okay? So as we look about it and say, if you were concerned about an exposure while you're on the job, I'm going to sit down and have a discussion with you and say, well, how did this happen? And I have all these diseases in my mind, and I think about, well, how does it move from one person to another? And I'm going to ask you these questions. And so how it moved, and then also how virulent it is. How strong is it? A cold, I'm not so worried about. HIV, yeah, I'm kind of worried about. That's a very hardy organism. And then the dose. So if you were using a tiny, tiny little needle for a finger check glucose, and for some reason that little sharp object, that little sharp solid needle didn't retract all the way, and you pulled it out and you kind of scratched yourself, so you'd sit there and say, oh, whoa, what's the likelihood that I just got something? Versus you're putting an 18-gauge needle in somebody that's hollow bore, and in pulling out, somebody bumps you and you poke yourself with a hollow bore, large bore IV needle. The risks are different. Does that make sense? Tiny, tiny amount of drop of blood on one, and a hollow bore needle that may be full of blood, 2 totally different risks. Okay? And then the last thing is if you're really, really old or really, really young, then your immune system isn't so good. So all you guys are pretty healthy, right? You have strong immune system, strong bodies, you're healthy. Cholesterol's normal, right? Okay? So that's something in your favor, because as we get older, our immune system doesn't work as well. And all those things factor into whether or not, if you get exposed, whether or not you're going to get. So one of the things we talk about the process of infection is if you got exposed to something, let's say you got stuck with a needle and you're concerned about hepatitis, there's a latent period where the virus got into you, but it's not replicated enough that you can't give it to anybody else just yet. Okay? But then once that virus is replicated, then you become somebody that you can infect somebody else. And we call that the communicable period, where you can infect other people. So now your blood becomes infectious to other people. That's the communicable. And the incubation period is the time between the time that you get exposed to the time that you see symptoms. And this is the hard part about infectious disease, is because you sit there and say, oh, I'm starting to get a cold. You start to sneeze and you get that headache. And so then you're like, okay, I got to be careful around my family. Well, you're about 2 days late. Okay? Because it takes a while for the symptoms to show up, but by the time the symptoms show up, you're already communicable. And the diseases vary. So HIV, for example, can take months to years to show up in your blood or for you to have symptoms. But during that time, you can be communicable to other people. And that's the crux of infectious disease. That's why it's so hard to fight. So it's kind of scary. So, to fight infection, the body has some defenses. And so it will create antibodies to attack the infection. And that's one of the ways that we determine whether or not you got infected, is we're able to look for these antibodies. They're unique to the virus. And that's called seroconversion. And so sometimes what we can do is, with vaccines, is we'll take the virus or we'll take the bacteria, we'll chop it up into little tiny pieces. It's dead. It's chopped into little pieces. And then we'll take those little pieces and we'll inject them into you. And your body doesn't care whether it's a whole organism or whether it's a little piece. It recognizes as a foreign body. And it builds an immune response against those pieces. And that's what a vaccine is so that if you get infected by the real virus, your body's already seen it before, and instantly, within 12 hours, it's attacking it and killing it before it infects you. That's what a vaccine is. Okay? Unfortunately, we don't have vaccines for all the diseases. Hepatitis B. So, what are the things that we can do that the body has to defend itself against infection? So, for respiratory stuff, your mouth and your nose are actually kind of a filter. This guy's got an extra robust filter. Okay, that's what the hair in there is for. Okay? And then, in the upper respiratory tree, there's mucus, snot. And so as the air comes by, if there's an airborne particle, it'll stick to that snot. And then the body will kick it out. It's called, there's a technical term for it. Wait for it. It's called the mucociliary escalator. Just like it sounds. So what it is that inside your respiratory tree, where the airway splits into the different lungs, there are these little hairs. And this is an actual microscopic picture. And you can see these little hairs on the surface of the cells. And those little hairs are constantly beating like a fan like this. And they make mucus, and they're constantly beating things up. And so if the bacteria gets stuck to this mucus, because it's sticky, then it's constantly pushing this up. And somebody actually measured it. Some scientist was bored. I don't know. They wanted to get published. But your body can transport through the mucociliary escalator. It can go like 3.8 centimeters per hour. Somebody figured that out. So it'll travel up here and get up into your throat, and usually you cough it out, or really you just swallow it. I heard somebody just do it right now. And you swallowed it. There you go. Mucociliary escalator at work, keeping you alive. All right. So here's the challenge. One of the reasons why cigarette smoking is bad, in addition to causing cancer, is it paralyzes those cilia, those little hairs. So they don't work. So if you smoke, then you put yourself at risk for more infection because you're blocking one of your body's defense mechanisms. Okay? Yet another reason not to smoke. All right. So then your body also has an immune system where it tries to recognize and says, okay, is this part of me or is it something foreign? And if it sees something foreign, then it tells the white blood cells to go around and surround and attack the organism, the bacteria, or sometimes the virus, and develop antibodies. And so what this is that if you have something that's a foreign invader, the body will make these little antibodies that latch on to the outside of the foreign invader. And there are two different ways to destroy the cell, either through complement-mediated lysis or through cells called natural killer cells that destroy the infectious organism. And so that's one of the main ways that the body uses. All right? There's also a lymphatic system. There's fluid in the body that bathes all the cells, and it gets filtered through lymph nodes. They're like fuel filters in your car. All this fluid gets filtered through all these lymph nodes, and when you're sick, you can feel the lymph nodes. That's just your body doing a good job at filtering the organisms, and the spleen is just a giant lymph node. It filters a lot of the blood in the gut and tries to clean infectious organisms. So the body's got its own defenses, and then modern medicine has developed a way to try, like I was saying earlier, to try and boost your body's immune system, and that's through passive immunity. So we give you vaccines. So all of you should have gotten a tetanus shot. Because believe me, you do not want the tetanus infection. It's life-threatening. Hepatitis B, you don't want that either, so get that shot. And then there are other ones. Every year you should get the flu vaccine. How many people have gotten the flu shot this year? I just got mine yesterday. It's worth it. You'll hear people say, oh, I don't get the flu shot. Because every year I get the flu shot, I get sick. And that flu shot causes me to get sick. No, it doesn't.
189.
What's that?
Because there's 189.
Well, and so remember what I told you about is that what we do is we take the virus and we chop it up into little pieces. So it's physically impossible for you to get the flu from the flu shot. It's all dead pieces. Now, are you going to feel a little crummy? Yeah, because your body's building the immune system. The pneumonia shot for older people, as well as meningitis, and there's a bunch of other things, there are a bunch of other vaccines. It's worth your while to do that. Now, we talked about BSI. Gloves, glasses. You can mask your patient if they're coughing a lot. But this is important, is to keep your skin healthy. Your skin is the #1 protection and barrier for you to keep you safe. And if your skin is dried and cracked, that's a perfect space for a little bit of blood or a little bit of spit to get in there, and then you get infected. It got in your body. Okay? So, as EMS officers, what do we do to keep you healthy and to minimize your risk for getting an infection? Well, one of the things we do is we try and prepare and teach you and educate you to make good choices. And we establish standard operating procedures that say, look, when you roll on this type of a call or this type of a scene, you are supposed to do that. We provide you with the resources and the tools so that you can stay safe. Okay? So the district has an obligation to provide you with gloves and to provide you with equipment and those glasses, which they do, for your safety. And in fact, if you come back and you're in a major situation, you get blood on your clothes, there's a process in place for you to get your pants laundered so that you don't have to deal with that. You don't want to take that home. Oh, I've got blood on my clothes. I'm going to wash it at home and infect the rest of my clothes. So there's a process in place. And if you don't know what that process is, you should talk to the officers here because it is in existence so that you can be safe. And part of this also is us trying to prevent what's going on by teaching you about personal protective equipment, whether it's a breathing apparatus or masks or whatever else. Again, to minimize exposure. The key is to not get infected, because once you get infected, so again, here's the famous guy. You don't have to do the fanny pack, do the other things, okay? So, and then the other thing that can be an advantage to you is that if there's open wounds and bleeding, to bandage them, because then you're going to limit contamination of your rig or your gear that could put your other crew members at risk. So try and address that, because you don't want stuff spraying around. It just creates a mess and creates more risk to your crew members, okay? All right, so we also do things to try and reduce infectious risk with preparation by using disposable equipment. So, you know, back in 30 years ago, we would reuse a lot of different things. And now this week in my ER, we're transitioning to disposable laryngoscopes. Never thought it'd come to that day. These are metal laryngoscopes, and they're sterile, and they've got batteries already built into them with a fiber optic light. Put it in, intubate, and throw it away. It's kind of a cognitive disconnect for me, but that's where we are today. So we have, whenever possible, disposable equipment so that we minimize the risk to patients, we minimize your risk. And so obviously there are other policies in place. So we have designated officers here in the district who are responsible for maintaining these plans and your safety, and ultimately I am on call 24 hours a day, 7 days a week, should something happen, okay? The chief knows how to get a hold of me, and it doesn't matter whether I'm asleep or work or wherever else, and if you guys get exposed, we will figure out a way and I will step you through it all. So we have a process in place. And then also, obviously you guys drill and train about hazmat, and that's a little bit beyond this scope with some of the really big, bad, ugly stuff. But we also have MSDSs available. Everybody know where that's at? I mean, I looked at it last year. It was back in the break room, and one of those big binders. There's an MSDS book that's got all the stuff and chemicals here should you get exposed. Provided, and it is done. So we talked about prevention. And now we'll talk about your response. And so when you get toned out, think about what's going on. What did they call it out as? And try and think in your mind the detail. What would you expect and what's the possibilities? And so before you even get into somebody's house, think about how you're going to repair. What type of equipment are you going to wear so that you don't do what I did and get yourself in a situation where you don't have a lot of protection. Prepare in advance. Assignments with your team. So don't forget BSI, and only limit patient contact to those that are necessary, you know. If it's a standard call, there's no reason for everybody on the team to get in contact. Limit that so that we reduce the risk of infection. And for respiratory stuff, particularly in the winter, with flu and colds going around, don't hesitate to put a mask on your patient, because that's going to limit the amount of stuff that they're throwing out, and it'll decrease your risk. Don't forget sharps, and probably not a good idea to eat in your rig. In there. I don't think the chief would be too excited about that either. Don't forget to wash your hands. Even if you wear gloves, wash your hands anyway. It's good to just get rid of all that stuff, and contaminated clothes you should get rid of and remove promptly using the process, and disinfect the equipment, okay? And biohazards should be properly disposed of and brought back here for safety. And again, if you're exposed, if you have a bloodborne exposure or a needle stick or something like that, 24 hours a day, you should talk to your 20 or talk to one of the chiefs, and they will get a hold of me, and we have a process in place, and we will get you through it and get you as soon as possible, okay? There was an act passed in 1990 called the Ryan White Act that was supplemented and endorsed by Congress. What happened was there was an EMS officer that was exposed, and there was, remember, AIDS was first characterized in 1986, so this is 4 years later, and there was a scare that he got exposed, and he wanted to know whether or not the source patient had an infection. And at that point in time, the pendulum had swung one way where it was like, you're not allowed to ask patients that question. I mean, anyway, we've since come to our senses, and they had to pass a law that says, it is okay. Do you have AIDS? I mean, there was a stigma associated with it, or whatever things you're worried about. It's okay to ask. The patient does have the right to refuse to answer that question, and has the right to refuse to provide blood But to this point in time, I've never had that happen with an EMS crew. If the 20 officer or me as the attending physician go chase down the source patient and say, hey, somebody that was really trying to help you and do a good job got exposed, this would really help us so that we can help our crews. Every single patient has been gracious enough to give us source blood so that we can run tests. So there are some limitations, but it is okay to ask for you as EMS crews. So the next question is, if the preparation failed and the training failed and you think that you got infected, now what do we do about it? And that's a complex decision because, like I said, there's multiple different variables. How big was the needle? How much blood was there? What's the odds that this person has an infection? Maybe they don't have an infection. Maybe they're homeless and you're like, whoa, I don't know what that person has. And so don't worry about it now, but those are decisions that I have to sit down with you and have a conversation, and we'll talk it all through, and I'll give you the numbers as much as we know to make informed decisions. Because there are some medications that we have to try and prevent, if you get exposed, to try and prevent the virus from getting into you. But there are side effects. Some of these medicines make you sick. You can be uncomfortable, and it can take a couple of weeks for these tests to process. So there is medicines out there to help. It's not without risk, but it is there, and I will step you through it. And we follow all the current CDC guidelines. And of course, it is confidential. If it happens on the job, this kind of gets treated as a separate process so that your confidentiality remains intact, but we're able to treat it as you need. Okay, so the next step is, well, how can I educate you to look for things so that when you go in, you sit there and say, ooh, maybe I need to be careful. Maybe I need to be extra careful about this one. Because hopefully you're all doing good BSI, but so I'm going to give you some warning signs and talk a little bit about some of the diseases. Okay? So the first hint is a rash. If you see a rash, there's an infection somewhere. Some of them are benign, some of them aren't benign. It's hard to figure out which ones are benign, which ones are not bad, and which ones are bad. So my advice to you is treat them all bad. They got a rash, they got something that you don't want a part of. So be extra vigilant about BSI and consider good airborne infections. Another one, you show up on scene, the patient doesn't have a rash, but they're sitting there, they look tired, they look weak, and they're dripping with sweat. You probably got an infection. And you don't see a rash. I wonder what their lungs sound like. So I learned many, many years ago, when I listen to a patient, I listen like this. And then I'll come to the other side and I'll listen like this. Because I used to listen to their chest like this. And then I was like, well, that's dumb. Here, breathe right here in my face. And that was another experience that I had is when I was a medical student, I was on the Indian reservation doing one of my rotations, and I was learning about strep throat. And so there was a patient that came in and had a really bad sore throat. And so I asked him to say ah, and his tongue was, most of this, it happens this way, the tongue goes up. So you can't see the back of the throat, you can't see the tonsils. So I'm a smart med student. Went over and I got the tongue depressor, the popsicle stick. So I pushed that in, and I found myself kind of holding his head, trying to push the thing down. I couldn't get in there to see. So I was kind of intimidated. I was like, crap, man, I gotta go back and talk to my attending. I know he's gonna ask me what the throat looks like, and I still couldn't see. So I was really stressed, and I went back, and I told him, and he kind of chuckled. He goes, let me tell you a trick. He goes, you can have your tongue blade out, but what you do is you have the patient open their mouth, and they kind of pant like this. They go, ha, 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 ha. And when they do that, it lowers the tongue, and then you can see everything perfectly. And I was like, oh, sweet. All right, I'll be right back. So I went back in, and I walked up to him, and I said, can you do this for me? And so he opened his mouth, and he started panting right in my face. And there were these big, huge tonsils with pus dripping off of them. And it was Absolutely, it was strep throat, and I'm so proud. I went back and I said, he's got it. We don't even have to swab this guy. And you know what happened 24 hours later? I called in sick because I had a sore throat. So be careful about how you do things and about how you interact with patients, because you're exposing yourself and you're putting yourself to risk. And if you see somebody that looks sick and they're dripping with sweat, you know, you start thinking, okay, where can the infection be and how am I going to protect myself and protect my crews? All right, what are the medical problems do they have? There are certain diseases that put you at risk to get more infections. Diabetes is one of them. HIV is another one because their immune system is toast. Transplant patients are on medications that intentionally lower the immune system so they don't reject the transplant organ, but that puts them at risk for infection. So when you see people that have these conditions or they're on steroid medications like COPD patients, and then there's the IV drug abusers that it's kind of like, well, just the fact that you use IV drugs, there's probably an increased risk. I mean, I'm not trying to like stereotype everybody, but you just have to go through and say, there's probably some good odds that there's some extra disease floating around there. So you have to be careful and you have to think about this and prepare. Your physical exam will tell you, do they have a temperature? Is their heart rate really, really increased? Is their blood pressure low? Is their oxygen level low? Are they coughing things up? Are their breath sounds really wet and coarse? All these things will help you say, yeah, this guy really is sick. And it should cause you to think about it and say, okay, should I put a mask on him? Should I put a mask on me? Should I be wearing goggles? If I'm the guy that's getting up doing the exam and listening to the lungs, should I be wearing goggles so that if he coughs, I don't get sprayed? All right, so let's go over a few diseases. Who knows the guy on the right? Okay, long since passed. And then the guy on the bottom, still alive and kicking. Okay, they both had HIV. And like I said, the human immunodeficiency virus, you can have it for years, but at some point in time, without medications, it destroys your immune system. And when your immune system is no longer present, then HIV is said to cause the disease called AIDS. Does that make sense? HIV is the virus, AIDS is the disease that it causes, and it destroys your immune system. It can be, you can get infected from blood, from sexual intercourse, and even breast milk, and contrary to belief, saliva or tears will not cause you to get infected with HIV. We do not have a vaccine, we do not have a cure. We have medicines that try and keep the virus from replicating, and people are living longer, but we do not have a cure. And so the risk is very, very low. If you follow the precautions that I've taught you today, and that you've been taught, since 2001, in 15 years, there's one case in all the EMS in all the United States that's been infected with HIV. So that's pretty good. The odds are in your favor if you follow the rules. Okay? If you do get exposed, PEP, post-exposure prophylaxis, it's a long word. That's where you come to see me, and we sit down and have a talk, and we start medications to prevent the virus from getting in. Hepatitis. Believe it or not, there's actually more than 5. I think there's 7 types. There's a Delta type 1, and I think there's an F now. There's different types of hepatitis. The most common ones that we see here in the States are B and C. In third world countries, you'll see A, which causes a lot of diarrhea, but basically it affects the liver, which is the organ that cleans your blood, destroys the liver and causes the belly to get swollen. And who knows, who can tell me what's going on with this guy in the top right corner of the screen? Yeah, that's jaundice. It makes the white part of your eyes turn yellow. It has to do with the liver not functioning well and toxins build up in your blood. Okay? You can get these hepatitis infections from blood, sex, and saliva, and we do not have a cure. There's a vaccine for hepatitis B, and all of you should have it. Healthcare workers, make a difference in your life. Make sure that you have the Hep B vaccine. We don't have one for Hep C, but Hep B, you definitely want it. And if you don't know if you have it, you should look at your records, and if you're not sure, if you're current, come talk to me, and I will answer questions so that we can keep you safe. Most of you are pretty young and healthy, and so if you've had your shots, you should be current. Okay?
What's the status on like a booster of that? Or
so the CDC says typically at 25 years, then immunity will start to wane, and that's when they will recommend looking for a booster. People that have higher frequency of exposures may choose to get a titer done. So they'll draw the blood and they'll look to see how many antibodies are in your blood. And if it's low, then we're like, well, we're not even at 25 years to get a booster. But at 25 years, it's recommended to get one.
25 years of age or 25 years?
25 years from the vaccine.
Okay.
So not 25 years old. So most of us get our last set of shots when we're like 14 or 15 in high school. And if you enter the service like this, then they're going to give you the hepatitis B series. It's a 3-shot series over I think it's over 3 months, 1, 6, and 12 weeks. And so it would be 25 years from that date. Okay? And if you don't know, then I can tell you how to try and figure that out with this titer. Okay? We do have a post-exposure prophylaxis. In other words, we have some antibodies that we've collected from people, and if you get exposed, we'll inject you with the antibodies. Even though they're not your own, they'll still work in an effort to try and destroy the virus before it gets into your cells. And it works moderately. But again, it's okay. Here are some of the other hepatitis viral facts that I just threw up. You can see the incubation period from the time when you get exposed to when you have symptoms can range for a long period of time. And again, that's why these diseases are so hard to control, because people are like, well, I feel fine. In the meantime, they be able to infect other people and cause other problems in the disease. Okay, you know these guys in the top right, bottom right? Yep. So he had tuberculosis, and that was one of the things that they used to think. I trained in Arizona, and there were a lot of tuberculosis farms down there. They had hospitals that were just for tuberculosis because they thought that the hot, dry air in the desert was one of the ways that you could treat tuberculosis. And it doesn't work that way. We do have antibiotics to treat this. However, they're developing what's called multi-drug resistance. And so when I was down in Arizona, now 20 years ago, we had a triple cocktail. So we were putting people on 3 medications, and we were starting to see an emergence of tuberculosis that was resistant to all 3. Kind of scary. It's not as rampant here. It's still pretty rare in the United States, but in third world countries, you'll see it a lot, and it's very debilitating. So it's very contagious. And so one of the symptoms that you can get is fevers, night sweats, and coughing with blood in it. Now there are other things that can cause coughing with blood in it, but if they have a fever and they're coughing up blood-tinged sputum, don't run the risk. Put a mask on the patient and send him in and transport him. And we'll do the test to let you know later on whether or not they have TB and if additional testing needs to be done for you. So pneumonia, strep pneumonia. So not nearly as bad. A lot of people survive from this. This is what pneumonia looks like on an x-ray. Is you get this infiltrate, this density in the lung, and so you get short of breath and coughing up phlegm and all that kind of stuff. We actually have a vaccine for this particular type of pneumonia. There are probably 30 different bacteria that cause pneumonia. The strep pneumonia, we do have a vaccine for, and so we give it to the extremes of age. You see the old people, the AARP parties, and they'll be passing out pneumonia vaccines. Get your chick pox, get your pneumonia. a vaccine, so that's good because it'll just spread through these nursing homes, okay? And we can give you some treatment if you get exposed to it. All right, chicken pox. How many had chicken pox? Oh, it's more than I expected. I think we've got a vaccine for this to try and treat it. Back when we were growing up, it was rampant. In fact, there were some families that would have chicken pox parties. So if you were on the block and somebody got chicken pox, then the parents would think, well, now's as good a time as ever, let's just get over with. So go over to Bob's house and go play for the day. Don't mind the little bumps. Just go out and hang out. And just go get the chicken pox and be done with it. We've tried to move on from that since then. We've got a virus, so we don't do that anymore. But I remember that. I remember some of my friends going to other friends' house for chicken pox parties.
So what's the deal with shingles then, the chicken pox?
Well, exactly, because now we're like, well, gee, I wish I never would have got it in the first place, because now you get shingles. That's horrible. It's a rash. It causes a very burning, sharp pain. It's horrible. So it's nice to get the vaccine if you can, because it'll save you a lot of headache later on. If you do get exposed, this is just fluid. It's body fluids. So these little vesicles will rupture, and each one of those vesicles has 500 or 700,000 viruses in it. Those little blisters, you pop that one, that liquid that's coming out is just crawling with viruses. You get that on you, and it gets in you. So that's why I was just like, yeah, go play with Johnny. It's going to happen. So we don't do that anymore. Get a shot. Get a shot and avoid it. All right. Another one is meningitis. These can be caused by strep pneumonia, flu, or Neisseria, and it's pretty serious. It's an infection of the membrane that surrounds the brain, and it can be lethal. Causes severe headache, and it can be transmitted airborne by breathing or by sputum. We do have antibiotics. We can treat it if we catch it early. And if you are exposed, we do have medicine to prevent you from getting the infection yourself. In fact, I diagnosed with somebody with meningitis probably 3 weeks ago, and it didn't take long. And then all of a sudden, it just spread through like wildfire through the whole emergency department, and all the nurses, the transport people, everybody just started crawling out of the woodwork. I think I saw that patient walk down the hall. I need treatment. It's like, okay, let's not get too overzealous here. Okay, but yeah, we do have treatment for some of these. The cold, sorry, we don't have much to treat it. Sometimes, if it's influenza, we can use a particular antiviral medication, but most of the time, by the time you get the symptoms, it's already too late. It's been in there. So fomites, it's airborne, and sputum, it's self-limiting. And for the influenza, we do have the flu shot every year because the virus mutates. So the shot from last year doesn't work for this year. So that's why you got to keep getting the shot every year. So it's worth doing. Please do it. Pertussis, we talked about earlier. We have a problem here in Washington State. You should immunize your kids. Trust me, it's worth it. Especially if they get whooping cough. It's very scary. And they can die from respiratory complications. Post-exposure prophylaxis, most of you should be vaccinated. If you're not vaccinated, you should get it. In fact, it's such a healthcare concern that if you need a tetanus shot, the tetanus shots now have pertussis built into it. So you don't get a choice. If you come and cut your finger, I'm going to give you a tetanus vaccine, and it's got pertussis with it. That's how bad this disease is. So you don't get a choice, you get it. We'll give you the vaccine. So it's all right. And I threw this in for completion because a couple of people have asked, and we hear about it on the news. It was first discovered in the Zika forest in Uganda. Now That's where Uganda is in Africa. And over the years, it's kind of waxed, and of course now it's made quite a public headway, and everyone knows about it. It infects the blood, and it's through, you can get it through a mosquito bite or through sexual intercourse. And men have been found to still have virus in them up to 6 months later. That's important. The symptoms are just like a cold. For you and me, unless you're pregnant, for you and me, it just feels like a cold. Joint aches, muscle aches, maybe a little bit of a fever, some red eyes, and after a week, it goes away. Nothing else. It doesn't cause any other symptoms. So it's just like a cold. The reason it's become such a public health risk is because if you happen to be pregnant when you get this, it causes, and that's why it's made the news. In rare instances, it can cause something called Guillain-Barré syndrome, but that's really, really rare. And the big thing, like I said, is birth defects, and the treatment is just supportive. We don't have anything to kill this virus, and you just got to run its course. So the key here is to prevent it. So don't go to places where this virus is at. And the big places in the United States is Puerto Rico and Florida. Okay? But I'm going to burst your bubble here in a minute and show you where else it is. And if you're in that area or with somebody that's potentially been exposed with mosquitoes, then you don't want to have intercourse because if you pass that way, and try and use insect repellent because most of the time it's by mosquitoes. And so this is what happens to fetuses that are exposed to the virus. So we don't know why the virus does this, but it causes microcephaly. And microcephaly is Latin for small brain or small head. And if you look here, you can see the back part of the baby's head is just really, really small. And here's an MRI that shows that it's just really, really tiny here. And we're still trying to understand the ramifications. You can only suppose that if they have a really small head and small brain, they're probably not going to be very functional cognitively as they grow up. But again, we're just starting to characterize this disease because it was in Africa for a while, and now that it's in the modern world, we're starting to pay attention to it. And so in 5-10 years, we'll see how these little kids turn out. Lest you think that you're safe, since we're on the opposite corner of the United States, I took this off the website from the CDC a week ago. This shows the incidence of Zika virus, and notice that every state in the United States has cases of Zika reported. Now, up here, we don't have mosquitoes that carry the Zika virus. So the only way you're going to get it here is if somebody traveled to a place where the mosquito was, got it, brought it back, and you had sex with them and got exposed to it. That's how you're going to get it. And again, if you're a dude, you're going to have a cold. If you're pregnant, that could be bad. So even us in Washington, we have cases being reported here. So just thought I'd bring you up to date. Something that's common.
I transported to Deep North one night, and that doctor said he diagnosed one earlier that day.
Oh, yeah? Yeah, so a lot of it's by travel history and symptoms. And again, if you're not pregnant, there's not really a whole much to worry about. We haven't seen any other permanent damage to adults. It's just uncomfortable. Who knows what these are? Yeah. That kind of makes me itch again. So causes a skin rash. These guys are crawling all over the place. Obviously, it'd be really nice if you use PPE because you don't want to bring that back to the house, to the squad house or your own house. So that's important. And really, just washing and decontaminating will help. And I promise you, you will treat and transport people that have this disease. It's everywhere. It's going to happen, and you'll see it. All right, so infectious disease can infect everyone, including you, even if you're not sick, because it can get into you. And some diseases are so infectious that the public health, greater good of the public health is more important than the individual, from the sense that the government requires us to report this in a semi-confidential way. Remember that bacteria are different from viruses. Bacteria live outside the cells, and that's why bacterial infections, we're really good at it with medicine. Because we have medications that can kill it, but it doesn't kill you. But viruses live inside your own cells, so it's hard to kill it when it's inside your cell. How do you kill a virus and not kill you? It's kind of hard. So the moral of the story is, don't get infected. So remember the steps to getting infection and transmission. It depends on what kind of organism it is, how healthy you are, what your skin is like, the environment, and the route of infection. And your best defense is to remember BSI and good PPE and healthy skin and get all the vaccines possible. Treat every patient as though they have some kind of an infectious disease, but have a heightened awareness around ones that you notice have some of the symptoms that we talked about that are sick. And if you do have an exposure, as soon as you can, as soon as you get back to the house, call your 20 and let them know so that we can process to keep you safe. All right, so make a mental note. Here are the questions. Don't answer this just yet. True or false? Bacteria live inside human cells. Think about the answer. Which of the following diseases is required by law to be reported to the government, the health district? Urinary tract infection, pneumonia, whooping cough, or ringworm? One way you can get giardia, somebody called it the little smiley face. Remember that little smiley face? The little smiley face is from mosquitoes, drinking stream water, sex with somebody that's got it, or eating poorly cooked pork. Oh, they're missing the best part. If it's a structure fire, we're all gone. Okay, where a pathogen lives, waiting for a home for a new host is called transmission, reservoir, environment, or life cycle. The period of time between when you are infected with a pathogen and when symptoms appear is called incubation, latency, communication, or menstrual period. All right, you guys better be able to narrow that down pretty quick. All right, Congress passed a law requiring patients to allow blood testing for diseases if a healthcare worker is exposed. You can get HIV by exposure to saliva, and you can get hepatitis B by exposure to saliva. Which disease causes you to cough up blood? Hepatitis, whooping cough, meningitis, tuberculosis. All right, you ready? Let's see how you did. Bacteria live inside human cells? False. Which organisms live inside the cells?
Viruses.
Nice. Viruses. Which of the following is required by law to be reported? It's whooping cough. Okay? That's how we know, and it's a very nasty disease, but it is treatable, but it's one way you can get giardia is from drinking the stream water. That's right. Be very careful. It'll filter that out. Where a pathogen lives, waiting for a new host, is called a reservoir. And the time between when you're infected and when symptoms appear is called the incubation period. Congress passed a law requiring patients to allow blood testing. That is false. Patients are not required to provide blood. They are required to be allowed for you to ask the question if they have the disease. But they're not required to provide a specimen. You can get HIV by exposure to saliva? No. You cannot. But don't kiss everyone. You can get hepatitis B through saliva. And the one that coughs up blood is tuberculosis.